The diabetes drug Ozempic has been used to help with weight loss, but recently researchers have found it can help with addiction, including alcohol.
So Dr. Payal Kohli is back with us now to talk about Ozempic. Mostly we've been talking about it in the controversy about it being a diabetic drug that has suddenly become popular for those people looking to lose weight. So now we're talking about it as maybe something that would help fight addiction?
Yeah, isn't this crazy? I mean, what we realized, and this often happens in medicine, we start studying a drug for one indication, and then it gets another, and then another, and so on and so forth. And so now we're seeing that it's changing people's behavior, and it's changing two types of addictions. It's changing drug addictions, like alcohol and others, like you mentioned, Kim, but also behavioral addictions, conditions like nail biting, impulsivity, excessive shopping, a lot of the things that we crave. And what we're learning is that maybe it's rewiring our brain a little bit.
Well, I'm a little worried when you say it's affecting our behavior, because that can go in a lot of different directions for many different people.
And for me, honestly, Tom, that is an unanswered question, which is that, you know, we're starting to scratch the surface of how it's changing our behavior, but it is changing our behavior. We thought it was just affecting our GI tract, our stomach empties a little bit less, we have more satiety. Now we're learning there's receptors in the brain called dopamine receptors, which are our reward receptors, our feel-happy chemical that's being modulated by this. So we have fewer cravings, we have kind of less interest in doing some of those things like shopping or coffee drinking or many of the other things that we sometimes get reward from.
Yeah, I think, you know, a lot of people would be excited about that. We all have behaviors we'd like to change. However,
you were looking at me when you said that.
I'm speaking for myself.
I
had a true confession in the commercial break.
Which one is your addiction? I'm curious.
Well, I have a few, but I'm a stress eater. But when you talk about this, though, I always work. One, I think a drug company is going cha-ching, cha-ching. And then do we really see the long-term impact of taking something like this?
You know, right now, we really need to think about human trials, and that's what are ongoing. In patients who are addicted to nicotine or addicted to alcohol, we need to see how the drug performs in them, you know, because right now, who it's been studied in are the diabetics and the obese patients. So we also need to think about, you know, obesity is confounded with food addiction. Often that is a cause of obesity. So are we selecting a patient population that's more prone to addiction, and that's why we're seeing these benefits?
Oh, that's true.
Yes, and so we also need to see it in a little bit in the general population.
So Ozempic now is used for diabetes, people use it to lose weight, and it cures addictions. It's kind of a wonder drug? Or do we just wonder about this drug, like what it's really all about?
No, we're starting to feel like it is a wonder drug, but with caution. We're starting to see in animal models, whether it's cocaine addiction, alcohol, even opioid addiction, that it's having good benefits. But I really think there are a lot of questions that I'm still wondering about. Well, what happens when you stop it? Do your addictive behaviors come back? You know, how long do those addictive behaviors sort of change? Do you start getting resistant to the effects of the drug, reducing those addictive behaviors? And then, as I said earlier, just sort of understanding, are there other types of behaviors, our mood, that may also be impacted by Ozempic? In the diabetes trials and the obesity trials, we didn't see people having depression. We did see some mood swings, however. So if it's changing our behavior, could it also start to change our mood in the long term? Of course, people lose weight, they feel good.
Yeah.
So initially we do have that, but the long-term effects, for me as a physician, I'm really wondering what those are.
We'll keep an eye on that. Well, I hope you have a great holiday weekend.
Yes, thanks for coming in Friday before
I hope your mood receptors are great all weekend long.
Whether you take anything or not.
I'm addicted to shopping, so I'll try not to indulge my addiction.
My Amazon driver would be really concerned if all of a sudden things went cold.
Keep it cool. All right, thank you. Dr. Payal Kohli.